President Trump continuing to boast about COVID-19 testing in this country, but only 1.3% of the U.S. population has been tested. Now the Rockefeller Foundation is releasing an ambitious new plan to test 30 million people a week at an estimated cost of $100 billion. The plan also calls for up to 300,000 paid testers and contact tracers and a common digital platform to track cases and resources. Joining me now are Rajiv Shah, President and CEO of the Rockefeller Foundation and a former USAID administrator, and Dr. Kavita Patel, MSNBC medical contributor and former White House Health Policy Director. Welcome both. Raj, it's great to see you. Tell me about the plan. How is this going to be paid for? How do you see launching it?
Well, thank you, Andrea, for having me, and it's good to see you again. The reality is our country's been stuck at 1 million test cases per week for the last several weeks. We know that that's not enough to mount an effective effort to do surveillance in America as the economy starts to reopen. And we're very worried of potential resurgence of this COVID pandemic, especially through the summer and into the fall. So we pulled together experts from science, from industry, importantly, former government officials from Republican and Democratic administrations, and said, what's a specific, actionable, practical way to solve this problem? And we concluded that achieving a goal of getting to 3 million tests per week between now and 8 weeks from now, and then getting up to 30 million per week in 6 months is achievable with a set of concrete and specific investments and actions we can make. I just note that the Congress looks like it's passing a bill that includes $25 billion for testing. So 100 is not inconceivable in an environment where we're losing $300 to $400 billion a month in economic output, and in an environment where we've already committed many trillions of dollars to supporting the response in this economy.
Is the expense the testing as much as the contact tracing? Where do you see the budget for this really?
Yeah, the two go hand in hand. Sure, the two go hand in hand. We estimate that somewhere between $5 and $15 billion of the $100 billion is for deploying a workforce of up to 300,000 Americans in a community health core that would be accessible and allow for cities and states to scale up their public health workforce for this purpose. The rest of the resources is really for testing, for investing in new technologies, for procurement, and we've proposed a very specific effort to bring together the supply side, the demand side of the market, and do larger scale, longer term pooled procurement backed by financial guarantees, and ultimately to compensate all testing facilities in a similar manner, whether they are in network or out of network, for the actual cost of the test. It turns out that 2/3 of America's molecular testing capacity is sitting underutilized in university labs and research labs and small labs that are not part of the CDC diagnostic surveillance system. We can solve that problem, but it's going to take leadership at the state level and leadership at the federal level. One other point, Andrea, is that we're not just putting this out as a plan. We've committed $15 million to accelerating its implementation. We're already working with a dozen cities and some states and some Indian reservations, Native American reservations, to scale up this plan in specific parts of our country. So it's got to happen, and we all got to come together to make it happen if we're going to protect American families and allow them to go back to work.
Dr. Patel, do you see the national leadership coming together behind this?
I do, and thank goodness for people like Raj and the work that they're doing at the foundation. In terms of national leadership, Andrea, well, I certainly don't see it necessarily emanating from the White House, but I do think that nationally, between governors and mayors, and then even in kind of your coverage on the state of Georgia, you're going to have municipalities that are asking for this. I also think that what they're doing at Rockefeller is critical to identifying the gaps. We've already seen in the United States that there are populations that have been overlooked, and they're consistently being overlooked. So we need, testing in and of itself is not the answer, even though we still don't have enough tests. We need to also make sure that access to that testing and access to healthcare professionals who can then do the contact tracing, as Raj described, that's critical. And then the kind of final piece of this is the isolation. And I mean, having people who are positive be identified. What you covered earlier about cases that cropped up before Washington State, Andrea, I think that's just the tip of the iceberg. I think we're going to learn that that was way earlier than anybody expected.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.